Hi, Ms. Patron. My name is Zhiyuan Wang, and here's my presentation for Unit 3 assignment. Here is the contents. CAGH is the abbreviation of Canadian Association for Global Health, which is formed in 2021 through the merger of Canadian Society for International Health and Canadian Coalition for Global Health Research. It is a member-based, not-for-profit organization. The members are champions for global health equity. It has a mission and a vision respectively. They visualize themselves as a part of a vibrant global health community, creating a healthier and more equitable world. And they expect to connect, engage, and mobilize a strong global health community across Canada and internationally in support of health equity. The organization consists of researchers, policymakers, practitioners, and students with academic and civil society partnerships across Canada and globally. The organization has four main functions: convening and networking, collaboration and partnership, creation, use, and exchange of knowledge, and capacity sharing and strengthening. They can bring diverse people together and share knowledge across the research, practice, nexus, and convene for global health training, networking, project work, advocacy, and more. Besides, they work in collaboration with Canadian, international, and LMIC partners. The organization supported research and advocacy efforts focused on fair and timely vaccine distribution during COVID-19 pandemic, ensuring that vulnerable populations in low and middle-income countries were not left behind. The Canadian Association for Global Health recognizes that climate change is one of the greatest health challenges of the 21st century. The organization works to strengthen the evidence base linking environmental changes such as rising temperatures, air pollution, and extreme weather to public health outcomes. It emphasizes that health equity cannot be achieved without addressing gender inequality. Its programs focus on improving women's and marginalized groups' access to health care. The association runs training initiatives to prepare health professionals, researchers, and policymakers to address international challenges. These programs develop leadership and strengthen local capacity, ensuring that solutions are sustainable and community-driven. It hosts the annual Canadian Conference on Global Health and runs year-round webinars and workshops. These events serve as hubs for dialogue, bridging research, practice, and policy. CAGH has directly influenced Canada's global health strategy and funding priorities. By providing research-based policy briefs and mobilizing experts, it ensures that Canada contributes to global discussions on pressing issues such as health equity, pandemics, and climate change. At the UN Climate Change Conference, CAGH advocated for health equity to be included in climate negotiations. By highlighting the human health consequences of environmental change, CAGH ensured that health become part of the global climate conversation. It has supported research capacity building in sub-Saharan Africa, enabling local researchers to lead studies on maternal health, infectious diseases, and climate adaptation. This investment in local expertise empowers communities to shape their own health solutions. Domestically, CAGH engages Canadians through public campaigns, education, and outreach events. By raising awareness at home, it strengthens public support for Canada's role in addressing global health issues. CAGH also works closely with Indigenous health organizations in Canada and with Indigenous communities abroad. These partnerships highlight the importance of Indigenous knowledge and ensure that health strategies are inclusive and culturally responsive. Since its formation, CAGH has expanded its membership base and international partnerships. It continues to build momentum, drawing new professionals, students, and organizations into its network. CAGH faces challenges such as fluctuating political support for global health and competition for limited funding. However, these challenges also create opportunities to advocate for stronger Canadian leadership in international health and to innovate in research and practice. CAGH will continue to advocate for equity, foster research collaborations, and influence global health policy. Its future efforts will build on lessons learned, ensuring that Canada remains a committed leader in advancing health worldwide. And here's my references. That's all, thank you.